Welcome to this week's episode. We are going to be talking about Proposition 129 in Colorado that passed this last November about the Veterinary Professional. What does VPA even stand for?
Veterinary Professional Associate, but they're also calling it an MLP, mid-level practitioner.
Okay. Yeah. And no one's happy about it. It's changing.
Some people are happy. Some people are happy.
The corporate people are happy. I think what's so surprising about Proposition 129 is that I was not aware of it even being on the ballot till about August. I don't know how it got there. Oh, well, I know now, but at the time I didn't know how it got there. And then no one really started caring about it until like 2 or 3 weeks before the election. And by that time it was too late because a lot of people had already cast their vote. And it looked so reasonable to the average pet guardian in Colorado. So basically they're saying, hey, do you want veterinary care to be more accessible and cheaper? And, you know, for people that love their nurse practitioner or, you know, their physician's assistant, it seems like a reasonable thing because it's kind of, it was advertised as it was correlative to that.
Yes.
What's the word I'm looking for?
Well, and I love my nurse practitioner.
I know, they're so much better.
I have good feelings about that.
They care about you more, or I think they do. So this mid-level practitioner, no one in veterinary medicine, I worked at one clinic. I did some relief work at one clinic that was a low-cost clinic, and they were excited about it. But other than that, there's no veterinarian that I've ever spoken to that's excited about this because this practitioner, this mid-level practitioner, is going to go to school for what, two years? Or how many semesters? 5 semesters. I don't know what that means.
For a master's. So their undergrad does not have to be in anything science-based.
Okay. And then they go to school for 5 semesters and then they can come into practice. And they're practicing under our license, under the veterinarian's license. And they can do really anything, right?
Almost. Yeah.
Is there anything they can't do?
I don't think they can write prescriptions, which then that's a bigger headache for you.
Yeah.
Yeah, I don't think they can write or dispense medications. They can dispense medications only if the veterinarian has written that prescription before, but they can't write a new prescription.
Okay. I printed off the information I could get at CSU, but they can do surgery. And these practitioners are going to be doing surgeries I would never want to do. I mean, 17 years out of school, I still don't want to do a spay of a big dog that's just been in heat.
Well, it's under this umbrella of routine or relatively easy, that's in quotations for those that are listening. But there is nothing routine about any surgery. I don't know how many surgeries you've been in that's supposed to be routine that quickly turns into something more.
Totally. Well, I think for, pet parents out there, a spay is a hysterectomy. And for people, that's major surgery, major abdominal surgery. And things can definitely go wrong in spays. Less often in neuters, but things can happen. And I don't want someone else to spay a dog or a cat under my license. I'm so uncomfortable with that. I sometimes don't want to do that under my own license. And I think they can even take out spleens. And this was just hearsay. I think all of this is coming together. And like Colorado always is, we're like the first ones to do it. We were the first ones to legalize pot, and now we're the first ones to ruin veterinary medicine. Too.
Right. Which, I mean, I guess we can be the golden child for what not to do. I have a feeling that a lot of states will let us try it out. Is what's going to happen.
And they won't pass it. Hopefully, they'll watch us and we can be the cautionary tale. And so within veterinary medicine, this is such a problem because we're in crisis already. And I think this was meant to help our crisis, but it didn't actually solve any problems. So right now we have a nurse shortage. And in veterinary medicine, we call nurses veterinary technicians, which I think does them such a disservice. And then that can be a whole
episode.
That's a whole nother episode.
That's a whole episode.
But veterinary nurses, and that's what I'm going to continue to label them as, they don't really have anywhere to go. And so veterinary nurses can make up to $25 an hour, you think?
Yeah. In specialty.
Yes. And these are the nurses that are anesthetizing your pet, providing them treatments. They're doing a lot of really high level and advanced skills required kind of activities. And so there's such a problem because there's burnout. No one can actually be a veterinary nurse in a clinic, make a livable wage, not get burned out. Like there's nowhere to go for them. And so it's not sustainable. And then veterinarians also don't make enough money, but we can make a living wage. We're usually overworked and slightly or moderately underpaid. And so there's a lot of burnout for both. But there's really nowhere for nurses to go. And so what this has done now is it's made the problem with nurses even bigger, because I suspect they'll bring in these mid-level practitioners and not even have certified nurses, right?
I don't know. Like that's the rub for me. You tell me how this feels for you, but it does feel as a veterinary nurse being edged out, in a sense, or being expected to go back for some schooling with knowledge that many of us already have. So it's like, do you take on that debt load to still make $25 an hour? But I also think it in some ways is going to edge the veterinarian out too, because why are you going to go for your degree and that level of debt and that level of responsibility for this mid-level practitioner to come in, which is really, in my opinion, going to put so much more work on your plate, not so less work, more work. Because now you have to write the prescriptions. Like they're going to be able to see more patients. That's true. I think that from a customer's perspective or a pet parent's perspective, their pet may get seen easier, quicker. But on the back end of that veterinarian now has a larger caseload.
Right. So in an average day at a clinic that I can have enough time, I will see about 15 appointments a day, sometimes closer to 20. In high volume, low cost, I'll see closer to 25. And so I can't imagine then at the end of the day how many more records I'm going to be wrapping up. And it's very difficult to keep up with records.
Records or what prescriptions need to be written or input you need to put throughout the day for where they don't have the experience yet, or stepping into the surgery that, that spay that, oh no, she was in heat, or, oh no, she was pregnant. Like that. I mean, those things happen.
And then the cost of it. So if this person, this mid-level practitioner is going to maybe, get into trouble and maybe they handle a case incorrectly, or God forbid something goes wrong during surgery, that's going to be under my liability insurance. And so then I guess the AVMA and the liability insurance, that's who I get my liability insurance through, PLIT, they're going to then probably charge me based off of how many mid-level practitioners work under me. Like, how is that going to work? How are they?
I think a statement on their website, I believe,
they do,
about that specifically. I had it pulled up earlier, but
the PLIT does,
because the spays and the neuters are where a good portion of their malpractice comes from.
Right.
I mean, that's a real thing. So if your fees go up, I can't see how your pay goes up, because they have to pay that mid-level who now is a master's, which I'm thinking if you have your master's, you probably want to make a minimum of $100K. Which I don't know. I don't know if that's even practical. I wonder what they're offering, what the expectation is for pay.
Right.
But
I had someone tell me that they thought that, I think it was a veterinarian that used to work in shelter medicine, and it was her opinion that she thought that it would only be Banfields at first. Because in 3 years, if they start this program now, in 3 years, they'll spit out, I think, like 20. They're going to take 20 in the first class. And they thought it would be exclusively at Banfield. And so they have more corporate funds, and they will force veterinarians coming out of school, because usually Banfield recruits right out of school.
Hey, okay. Well, I'm like, what do I say? What do I not say right now?
No, say whatever. We say whatever here.
Okay, when I hear that and the corporate piece of it, one, I'm like, okay, well, are they paying off? What's the agreement? Are they paying off some debt? Because I have found that these corporate organizations are some of the lowest paying organizations. When I'm sifting through the roles, it's more small practice, solo practice practitioners like you that are paying their people better. than the corporations that have the funds. So I just get a bad feeling when I hear that, because that will set the bar of what everything else looks like.
Yes. Well, I think what the big corporations can offer is the signing bonus. And so they do the signing bonus and they recruit you on for 3 years, or, and I think they're good signing bonuses. I've never worked for a corporate clinic, but I mean, out of school, I was recruited really aggressively by Banfield. They still try to recruit me. And so they have big signing bonuses. And so I wonder if...
And benefits.
And they have benefits. And that's one nice thing. So maybe the hourly rate isn't as good, but they do have better benefits for sure. But I think that's how they'll get veterinarians to agree to this, because I just don't know a veterinarian in the Denver metro that's going to say, oh yeah, this is fine. I like this.
My fear is that we're going to have an exodus. I'm actually really worried about this. Because when I say they're going to, with the edge out for the veterinary nurse, and I don't know about other veterinary nurses, but for me, when I'm reading what the tasks are, I'm thinking, wait, that's my task.
Ooh, like what?
Dentistry. Like what? That's my task.
Oh, so
monitoring anesthesia. That's my task.
They're going to be doing that now?
That's on their list of things that they're learning. Yeah, some of their. So I'm like, wait, so where am I going? Am I just going back to restraining? Because that's not interesting.
Well, that's where I think they're just going to have these mid-level practitioners. They don't have to pay very much. They're going to have veterinary assistants, so not certified nurses. And then they're going to have like one veterinarian, a miserable veterinarian. And then they're going to have like 5 mid-level practitioners.
Well, you already have miserable veterinary nurses because they're underutilized.
Everywhere.
So many of us, some of the states I worked in were not even allowed to give a rabies vaccine. But then in another state, you can.
Yeah.
So it's just, there's a lot of ways in which we already feel underutilized.
Well, most nurses aren't happy because they're not making enough money and the job is hard. Even in a hospital setting or in human medicine, you have nurses and then you have medical assistants and then you have, there are people that clean the rooms and,
Right.
You have a lot of staff, and veterinary nurses are all of those. Like you're filling prescriptions and cleaning up a mess and, taking x-rays. So you're, in radiology and you're the dental
surgery.
hygienist and like all of it. And so I think that most hospitals that I go to have some level of burnout. It's very rare that I go to a hospital where the nurses are happy, and I've never been there. There's always someone that's unhappy because they've been around for a while and they're tired.
Well, how many nurses have you met my age? There's just not.
There's not.
That's why there's just so I am concerned. I have concerns on so many levels for the pet parent who doesn't really know. Like, there's going to have to be new questions they ask when they're coming in for procedures to vet who they want doing the procedures. Like a new level of advocacy they're going to have to do for themselves.
Yeah. So what do you think pet parents can do in Colorado in 3 years' time? What do you think the move is for them?
Well, I think some of it's the same that it has been in terms of how we really advocate pet parents. So if you're going to take your pet in for surgery, what questions are you asking about? Who's monitoring? What certifications? I think they're going to have to ask that just to have another practitioner.
Yeah.
Who is overseeing my patient? Who's overseeing my pet's care? Who is the person I'm contacting when my pet has an emergency? Like, who is that person now?
And if it's a VPA, do they just go to a different clinic?
Well, the truth is they're going to be seen quicker. That is true. So they're going to have to weigh what is most aligned for their needs. I don't know. Like, I wish I could advocate pet parents to ask all the questions. How are your employees being treated?
Totally.
What is? Yeah. I don't know.
Yeah. That's how
Do you have an opinion?
refer.
What do you think they should be asking?
I mean, this might feel, there's something that feels a little immature about it, but there's part of me that's like, don't go to them, boycott them.
Yeah. But it's not their fault. Right?
It's not their fault. They're going to be the most hated professional coming in.
It's going to be so rough.
So like, if you're thinking about applying for this program, don't. Like, if you're hearing this and you're thinking, maybe I should do this, I don't think you should.
I think it's going to be so stressful for them too, because I think when I'm reading what I'm reading is the curriculum proposed by CSU. And for 4th semester is when they finally get into a lab in person. First 3 semesters are completely online. Fourth
How can you do
semester,
anatomy online?
they get physical exams and routine care, anesthesia lab, diagnostic lab, clinical skills lab, communications lab, surgical skill lab, dentistry lab. And then their fifth semester, they get to do an internship. And from what I'm reading, a lot of this is large animal, small animal. It's not like,
Oh, yeah.
So I'm like, okay, let me think back to like I like to say, I went to school on a farm. So I had a full semester of large animal.
Mm-hmm.
Everything that I still remember to this day is because I did it like it was deworming the cow, like not reading it in a book. It was birthing. It was, debriding the nasty wounds that sheep get.
Right.
But all of that stuff because I actually hands-on did it.
Yeah.
If I read it in a book, I'd be like, whatever, I don't remember that.
I mean, in vet school, we did have the first 2 years, there was a lot of coursework, but we were always touching animals too.
Mm-hmm.
And we learned anatomy with cadavers of
they
all
do
kinds.
have anatomy.
But is it in person?
No, online. They have clinical anatomy. Yeah, anatomy came to me from dissecting cats. Like,
yeah,
if we're telling truth, like I still don't like to eat chicken after that. Like, because there's like something about hands-on doing
right.
that.
Which is important, especially if you're going to be doing surgery.
Well, and it's a 2-credit class, clinical anatomy.
Why? What do you mean it's just clinical anatomy? What does that mean? We're only learning anatomy?
That's what I wanted to know. What does that mean? What's clinical anatomy?
I'm a little disturbed that it has mathematics, 5 credits, college algebra.
Oh, I thought that too, but that's your prereqs to get into the program.
Oh, that's a prereqs.
Yeah,
okay, good.
I first read that too, and I'm like, what?
Like, wait, what?
Really worried. I saw that too, and I had a moment where I had to take a breath.
Yeah.
I was like, wait, my kids qualify for this? What's happening?
Yeah, so clinical anatomy, it was 2 credits. That's rough. Principles of radiology and ultrasound, 2 credits. Infectious pathogens and parasite. I mean, I think of all the schooling and that I did, and I just think, and so now I have there are a lot of veterinarians that I've spoken to that just feel so slighted by this.
So slighted. That's justified.
Yeah. Just
and
I
don't shame or wish any ill on anybody who wants to take this. It's so appealing and interesting. But I even found it, and there's some shame I have around this next piece, but I have some, so they are aiming it toward veterinary technicians who want to take this. That's how they are putting it in this box or selling it. But you have to have a bachelor's degree. And I'm like, I don't know very many veterinary technicians that have bachelor's degrees.
No.
And I've wanted to go back to school, and I cannot believe how much coursework they want me to redo at this point. So I'm like, So now you're talking about getting me into, $100,000 in debt.
Oh my gosh.
So
and
it's not
do the things
really
you're already
slated
doing.
for us. It's not really slated for veterinary technicians because most of us don't have that bachelor's degree. Right. But that's a shame piece, right? Because I have shame that we don't have a bachelor's degree.
Right. And then this mid-level practitioner is going to have a master's.
Yeah. So it just makes me feel lower and lower in the industry.
Well, I think that's where they really left veterinary nurses, is instead of saying, okay, how can we take them where they are with an associate's and then elevate to the next. That's really what we needed. Mm-hmm. And this
and I know so many of us would have jumped on that.
Totally. But I don't think any veterinary nurse wants to do surgery, except for maybe
most of us didn't become veterinarians because of it. Like that, right? Like I don't look at your job and think, yeah, I definitely want to be a veterinarian.
Right, because you would have done that.
Why don't I want that? I mean, it's so much more stress. Like I feel I have enough stress.
Right.
But it's so much more stress. So much more school debt.
So much more school debt. I don't know what
and your pay just is not, it doesn't, like that's when I was really thinking about being a veterinarian. I'm like, the amount of debt I'm going to have for the ROI, for the return on my investment.
Yeah.
Yeah, I don't know. And I wonder, so that VPN is very appealing. Super appealing.
Yeah.
Because you're still responsible for me.
I know that's true. You're like, I get to do all the things.
Yeah.
And there's no board that's going to take me to task.
They don't even have to go take a national exam. I've had to take every state exam and every national exam.
Totally.
They don't even have to take a national exam. For me, that's just mind-blowing.
I hope the word gets out and other states cannot vote this in. I think it's really strange that this would be up to a public like vote. And maybe I don't know enough about government and how medicine is regulated, but why wouldn't we be responsible for this? Like, why are we asking our clients to fix this problem for us?
And where was the conversation about how do we better the veterinary industry? Where was that?
It did
and
not
maybe
happen.
That's where we're headed in our conversations. Right?
Yeah.
Like what does fix the veterinary industry?
Yeah. Well, food for thought. So if you're a pet parent listening to this, and in 3 years' time, so it's December of 2024 now, and so I guess I wonder when they'll actually start.
Well, they said they're going to graduate the first class 2027.
Okay. So in 2027,
might have been 2026.
Okay, well, they better get on it. They have to have people apply right now. So if you're thinking about applying to this, probably don't. And then if you are a pet parent, I would really consider giving this some time. Maybe that's the advice. When new drugs come out, new treatments come out, I always just take a beat. And I let things kind of settle out. I remember when Silencia, the injection for arthritis for cats, came out. I just was like, I'm going to chill for just a minute. And, some of my patients did miss out because of that. But I've also took a beat with Librela. And Librela has some issues. Mm-hmm. And so I'm glad I have. I remember when they rolled out ProHeart.
Huh?
And they rolled it out too quickly. And then, some dogs lost their lives. And so I think pet parents should take my advice and just give it a minute. And let's not let your animal be the one that's ironing out the kinks, because that's going to drastically change everyone's day when this person comes in. And there are going to be, oh man, there can be so much drama in veterinary clinics anyways amongst staff. Can you imagine what's going to happen now? I always tell people to take their pets where people are happy. And I think that's really important. And so my advice is give it a beat. What do you think?
I think that's great advice. I would take that advice on our end too, right? Not just to pet parents, but let it play out, because maybe it will benefit rural clinics. Maybe there are some clinics that it's really going to benefit, and we just aren't in need of that specific role. But there might be clinics and shelters that really do benefit from it. Farms, who knows? It could play a bigger role than with what I've let my mind imagine.
That's so diplomatic.
Oh, but it's the truth. I always am diplomatic. I can see things from all sides.
That's your gift. I think I'm just not ready to make nice yet.
Oh, I'll play nice for us.
I just am not ready. I'm I can't see the good in this at all, but maybe I'll get there. We have some years.
Well, it's not coming from my role either, because I work for you, so I know.
That's true.
If I were in a clinic, I might not be so diplomatic. I don't know.
Right. Yeah. Okay. Well, you can find out more about this at CSU's website. Is that right? Here, I'm just going to go.
CSU does have one.
Yeah. If you go to vetmedbiosci.hollowstate.edu/VPA, I will put the link to this in the show notes, and we would love to hear what you think. So you can comment below and let us know what you think. Anything else, JoJo?
That was fun.
Okay. Talk to you all soon. Bye.
Bye.